let's bring this up to the dais for comments from the elected officials. And Commissioner Williams, if you can hear me, if you'd like to make some comments.
Yes, I am ready. So
Please.
I really appreciate honoring our public health department. You know, when I first came in as a commissioner, it seemed like we went over to the health department for our introduction. They did a lot of programs. It was fascinating. And their biggest issue was a hepatitis A outbreak amongst the homeless. And they were spending a lot of time out in homeless communities, making sure that they were vaccinated against hepatitis A. And then, of course, we were hit with the 100-year pandemic, and none of us had ever been through a pandemic before. Many of the laws in place, I feel, were still left over from the last 100-year pandemic in 1919. And so it became quite a problem for us. I'd like to thank our health department especially, but I want to take a moment to thank some members of our community. We worked with the Office of Emergency Management, the United Way, the Chambers of Commerce, the Monument City Council, the Fountain Council, many other individuals. We've also worked with our city council, and they've had an awesome response, and we've also worked very closely with our Mayor, John Suthers. I really appreciate the perseverance, though, of our own staff. And it's a long list, just even the senior staff. Lori Seago, Diana May, Leon Kelly, Robin Johnson, our public information office, Ryan Parcell, Natalie Sosa, and Michelle Hewitt, Deanne Ryberg, our hospitals, the UCCS College of Nursing stepped up. And also Kenny Hodges did great work as working with our health department. I will say we've had anger, tears, harsh words, and exceptional frustration, sometimes with our governor, sometimes with our state legislature, recently introducing a bill trying to remove commissioner powers from the Department of Health. And that's been frustrating because while the Department of Health sees the medical side of the community, commissioners are elected to see the economic side of the community. We spent a lot of time crying with businessmen and fathers who weren't getting their weddings for their beautiful daughters. But most importantly, the public health employees, a group of such hardworking individuals who have put up with a lot from people calling to complain. We went from probably, a few phone calls a day to a gazillion phone calls a day, and many of them were angry. And they worked really hard to learn and to be patient with our public, giving answers as quickly as possible. And I just wanted to say, kind of borrowing from a business I was able to tour last week, they've had a stellar response. They have treated this response with great attitude, but also great altitude, showing that we can reach new heights no matter what the circumstances. So thank you to our public health department employees. We look forward to working out of this process and working into different items of public health that we need to in the future. Thank you very much.